Hey, Bevan, how are you?
I'm fine, Dr. Krishna. How are you doing?
Hello.
Hi, I have Melissa over here with me, my business partner, and we just wanted to say thank you for coming on and doing this interview with us.
Hi, Dr.
Thanks.
Krishna.
I didn't hear the first part. Could you repeat it?
So I just want you to meet Melissa, my business partner.
Okay, great.
Yeah.
Hi,
How you
Dr.
doing?
Krishna. Nice to meet you.
Hey, Melissa, how are you?
I'm doing well. How are you?
Okay, I'm fine. Can you hear me okay?
Yes.
Yeah.
Okay, great.
Yeah. How was your Thanksgiving?
Pretty good, very relaxed. How about you?
It was good. We relaxed too. I didn't do much.
Yeah, that's right. Usually downtime for everybody this season.
Yeah, it is.
This month, and then Christmas and New Year's also downtime.
Yeah,
Yeah.
it's nice.
So where are you guys located?
I'm in Los Angeles, and Melissa is
Okay.
in Portland, Oregon.
Oh, okay. So you guys are all the way out in the West Coast, huh?
Yes, yes.
Yeah.
Ah. Did you get a lot of smog from the forest fires over there?
We got the first 2 days it was a lot of smog. It was the air, you could smell it burning, like the
Uh-huh.
rubber. You could smell it in the air. It was only for about 2 days.
I see.
Yeah. And then it
I see.
disappeared because the wind was blowing it back out to sea.
Now it must have died down now, everything, right?
Yeah, it's died down. Yeah.
Yeah. A
People
lot
are
of
starting to go
damage.
back home.
We see on TV a lot of damage,
Yeah, it's really bad. It's especially up north.
Uh,
In California, it's worse. It's a lot of people lost their homes. It's really bad.
that's terrible. The amount of damage with homes that are lost are terrible, especially with belongings. I wonder what's going to happen with the future. They should really figure out a way to prevent that.
Well, we got to plant more trees. It's about planting and figuring out a way to. I guess because it's so dry, it's
Yeah.
hard. Without water, the plants is not growing, and that's something we have to figure out. As a community, and how to better the different areas. Just something on the East Coast too, with all the hurricanes, the flooding. It's just the climate change.
Yeah, I mean, California has a problem. Up north, Washington State, Portland State don't seem to have that problem at all.
Mm-mm.
No,
No.
they're pretty well irrigated. They get a lot of water up there.
Yeah. We did have one crazy fire that was started by a firework by a kid throwing it off over by Eagle Creek, which is up north, closer to Washington. And it destroyed one of the biggest monuments in Oregon. I don't know if you ever heard of Multnomah Falls.
Yeah.
Yeah, it completely obliterated the forest area and everything. But luckily, like the cabin and everything over there is still intact. But yeah,
Yeah, Portland is a very pretty part of the country, Oregon State. Yeah,
it is.
very pretty.
Yeah, I really like it here.
Of course, it's gorgeous.
Yeah.
Washington State, Oregon State, they're really the great American Northwest.
Yeah, the summers are nice and when it's not raining.
That's right. So great. Are you guys ready? I'm ready also.
Yeah, we're ready.
Okay, great.
So we're just gonna about 10 minutes. We just want to ask the questions real quick.
Okay.
Your time is important, and we just thank you
No
for
problem.
your time out.
I'm with you.
And so I'm gonna go through the questions.
Sure.
And Melissa and I are just gonna do each other question, and if any like quick follow up, we'll ask. But we
Okay.
just want to stick to what we have here, so there's no confusion, and we just want to keep it really short and sweet. And
Sure.
this is being recorded, so I want to post it on Reddit, on Instagram, and I guess after we're done, if you could shoot me like any links you want me to use to like people could find you and the phone
Yeah.
number. After on Reddit, you could just send me a message, and then probably post this next week.
Okay, great. Thank you.
Okay, thank you. So first question we have is, how long have you been in practice?
Oh, I have been in practice since the mid-1990s, all in New York City. I've been practicing primarily within the boroughs of New York City. Brooklyn, Queens, Bronx, Manhattan. And we grew from 2 locations in New York City to multiple locations now throughout the city, servicing the inner city primarily.
Okay. When did you know you wanted to become a doctor?
Probably when I was in high school, I started getting interested in epilepsy. I had many friends who were in high school who unfortunately suffered from epilepsy
Okay.
or throughout the years, and I became interested in college in epilepsy. Um, did some research in college in the field of epilepsy, and then ultimately, after I decided to do my specialty training in neurosciences, I became more and more interested in the field of epilepsy and neuromuscular diseases, and did a fellowship in the same. And that's been sort of my core passion, is neuromuscular diseases and epilepsy.
Just quick question. Have you noticed a difference in the treatments from when you first started to now?
Yeah, it has. If you go back into the 1980s, and I'm dating myself, unfortunately, uh, and I'm only 16. But that being said, when you go back into the 80s, I could count the number of drugs that we had for epilepsy in one hand. Today, I think I could fill a room full of samples for drugs that we have now. It's dozens and dozens of drugs that we have available, and I credit that in a large part to if we sort of think back when Ronald Reagan was president, he created the Decade of the Brain as an initiative for the National Institute of Science, and for good or for worse, they had given a lot of money to develop treatment protocols, scientific architecture of the brain, and they spent a lot of time, effort, and money in developing the basic research behind the brain, especially things like Alzheimer's disease, dementia, and epilepsy, and migraine headaches, and others, chronic brain conditions, Parkinson's disease included. And that has resulted in an explosion in the number of drugs that we have today. Especially in the field of epilepsy, we have so many medications that are out there that we rarely need to now go to do surgery for patients with epilepsy. And one of the newer agents on the block are really the additive agents of CBD. CBD is really helpful as an additive adjunctive treatment in treatments with patients with epilepsy.
Do you find that CBD alone it's more beneficial, or like a full spectrum product with the other cannabinoids?
It's a great question. CBD alone has been shown of some benefit, but with a full spectrum treatment with other cannabinoids is probably much better. In addition, we know we have in our practice here in New York, as it's been allowed over the last 2 years to use medical marijuana for treatment for patients in various conditions, epilepsy being one of them. We find that using it as a adjunctive treatment to conventional medications helps significantly improve seizure control. You probably have seen some of the articles and treatments of a childhood form of seizures called Dravet syndrome.
Right.
It's a very severe condition. When you see those kids, it's heart-wrenching. It's really terrible. These kids have dozens of seizures a day, and it's you sort of wonder in yourself as how these parents even emotionally survive, because you put yourself in their position as a parent to think that, it's very difficult to watch your child have 20, 30 seizures a day, especially young kids. These are small kids who are, a few years of age. Additionally, these kids are progressively declining in their cognition, in their mental capabilities every time they have a seizure. The use of cannabinoids and medical marijuana in that space has been miraculous, to say the least. That's one of the main reasons why it was approved by the Food and Drug Administration for compassionate use in an early stage of its trials. And it has helped dramatically reduce the seizures to maybe zero sometimes in many cases on a daily basis. We use medical marijuana and cannabinoids as adjunctive treatment for adults, especially with difficult to treat seizures. So if a patient comes in as an adult, has seizures that are not being treated by one or two medications alone, we use medical marijuana as an adjunctive treatment to help this control better.
Okay. I have a question. What motivated you to become a medical marijuana doctor, and what's your experience with cannabis?
Well, I've never inhaled, but but that being said, I've had, I've been interested in this space over the last 6 or 7 years, where I've worked with other companies developing drugs for treatment of neurological diseases, because the vast majority of indications that medical marijuana is indicated for, and I'll use the generic umbrella term medical marijuana just for the sake of discussion.
Okay.
Medical marijuana is used for a vast majority of cases are in this realm of neurosciences or neurological diseases. And that being said, I sort of worked with several companies in developing drugs for them and combination therapies for them, for which we have filed patents. We filed several patents. Many are in the pipelines, many are approved. And this sort of spurred my interest in that the future of medical marijuana is really in treating patients with severe conditions, and neurological conditions, unfortunately, when you're diagnosed of it, for the most part, are chronic and severe. So we need to be able to better treat those patients and improve their quality of life. If we can't improve their quality of life with the current set of medications and get the best effective treatment, I wanted to look elsewhere, and I found medical marijuana useful in certain groups of patients in assisting in controlling their disease states.
Oh.
And that's what really made me interested.
Awesome. Do you know of any medications that might interact with CBD and THC that you're that affected by your patients?
Yes, there is. So for the most part, CBD, THC, combination drugs, and medical marijuana on the whole is very safe. Really, there's no significant life-threatening side effects. However, because it sometimes acts through the various hormonal pathways in the brain, one probably has to be slightly conscious of the fact that you can get hormonal imbalance, and this hormonal imbalance can translate into other complications. One complication could be, and it's a hypothetical complication, which is theoretical, based on the hormonal pathways, is in young women who take oral contraceptives for various reasons. Women could take oral contraceptive tablets to regulate their hormonal cycles, or as a hormonal supplement just to prevent contraception. Either way, the issue is that THC and medical marijuana can cause an alteration in that control pattern, because it can sometimes deregulate the mechanism that is put into place by the oral contraceptive tablets, and you may end up having a change in your control of your menstrual cycles. You can also have a potential change in the ability to prevent conception. So women, I always explain to young women that you have to be careful when you're taking medical marijuana, and if you're taking oral contraceptives to prevent conception, please use a second line of agent also, because it's sometimes difficult to predict how medical marijuana interacts with the hormonal pathways that control conception.
Yeah.
That's one issue. The other issue is um, other hormonal pills like thyroid function tests, thyroid medications, blood pressure medications, um, and antidepressants seem to have a uh, interaction with medical marijuana. It's unclear how severe an interaction. I always like to explain it to patients to be cognizant of the fact that if you find that your blood pressure medicine keeps your blood pressure within a normal range, and then you start taking medical marijuana and you find that you're getting really low on your blood pressure, then you may need to take less of the blood pressure medication. So that you have to be a little careful that it's not creating a side effect that is prohibitive, but a side effect that you're aware of so that you can modify the medications.
Okay, that's awesome. With that, is there any way advice that you would give a patient who wants to talk to the doctor, but they're scared, to bring up the topic about cannabis?
Yeah, I think it's I think that's a wonderful question, because many patients in the past have been scared to talk to their physicians, which they shouldn't be, actually, because the physician is a person that you should be able to talk freely with. And many patients are scared to talk to their physicians about marijuana and other agents like this, just because they feel that it has this negative connotation. But now, thankfully, many states have approved it, so that dark cloud that lingers over medical marijuana is slowly being removed. That being said, it's important that patients, when they go to talk to their doctor about their medical condition or their neurological condition, they discuss with their doctor all potential treatment alternatives out there, and say, doctor, are there other natural treatment alternatives out there? And you can bring up, that you've read online that medical marijuana has been used for your condition. What is their thoughts about it? There's nothing wrong in bringing it up now, especially if you live in a state where it's legal to prescribe for physicians for medical marijuana. And I would suggest be proactive, because if you are not proactive, many physicians just don't naturally like to offer it because they don't understand it for the most part. It's a problem on our side of the coin, on the healthcare delivery side of the coin, where we have not done a good job yet in educating physicians on how to broach the topic of discussing medical marijuana as an alternative treatment pathway. But I think over time that'll improve, given that it's being approved in many states. But I would suggest, if you're a patient in this day and this time, it's important that if you have a diagnosis that is one of those diagnoses that are potentially treatable or controllable or improved by medical marijuana, please take in the data, print out the data. I always suggest print out the data from online resources, take it to your doctor and say, what do you think about this, doctor? And leave it with them to digest. Don't, confront them with it. Say, think about it, give me a call back in a day or two, let me know what you think. It's not a bad idea to start the discussion that way.
Awesome. Yeah. But the VA system, the doctors don't want to talk about it. So it's a lot of our supporters and the community, they're very scared to reach out to the doctors, and
yes,
they don't know how to start, the conversation.
Yes, you bring up another important issue. The Veterans Administration system, which is federally funded, has an issue, because the federal government still has this dichotomy of scheduling. They've scheduled medical marijuana as a Schedule I agent, which is still in the process of being rescheduled and changed. And I think that will happen. The way things are going, that's going to happen. But for those patients who are stuck in the VA system as their only treatment alternative, I think they're having a difficult time, because they just don't have access to the drug through the VA system.
Right.
So it's probably a good idea to talk to the physician, but unfortunately, they would probably need to seek private healthcare outside the VA system in order to be able to access the medication.
Okay, thank you. I've been wondering. I know when I first met you, you was doing some studies on the correlation of pain management and CBD.
Yes.
Are you still working on any? And can you share anything with us about it?
Yeah, I can. I can definitely say we've had the privilege of publishing a few of the studies. We did our first year retrospective look on compliance, because when we prescribe a patient with medical marijuana, it's not like I prescribe a patient with a prescription drug. If I write a prescription drug, you just go to your CVS or Duane Reade pharmacy or Rite Aid pharmacy, and you pick up your drug, and it's covered by your insurance. Here, unfortunately, in medical marijuana in New York State especially, we have to do a whole background paperwork for you. It's almost like getting a permit. And then ultimately you get an email in your email saying that you have a permit with a number, and you can go to a particular dispensary. And we have a dispensary, in every borough, which is not convenient. It's not like a corner store that you can go to, but you have to go there, and then you have to pay for it. It's a couple of $100 a month. It's not cheap. It's definitely something that you have to pay for. You have to take the time and effort to go there for it. And you have to have a real diagnosis for it that is supported by diagnostic evaluation. That being said, we were curious. We were just curious to see that, hey, listen, are patients compliant to the medications? Are they just being prescribed it and not compliant? And we found that we had more than 2/3 of our patients, for the various diagnoses that we prescribed them for, primarily pain-related diagnoses, some epilepsy, some migraine headaches, some fibromyalgia, and many neuropathic pain or nerve pain, were compliant. They were taking the medication, they were finding it efficacious or beneficial to their health, and they were overcoming the financial hardships that were required to buy the drug. So they were really compliant. That means that, that tells me that it's actually working for them and helping them. Otherwise, why would they take the extra effort to go out, go for 45 minutes to a train, take a train, go to a pharmacy, pick up the drug every month, take $200, $300 out of their pocket, buy the medicine, and then come back when, if it's not working, then they wouldn't do it.
Right. That's true.
And that was actually one of our first articles we got published. We actually have two more that we've recently submitted. One is on phantom limb, which is an interesting condition where patients get a loss of a limb, like amputation of a limb, for various reasons, and it's a very difficult condition to treat because it has a physical component to the condition and a psychological component, and we found that medical marijuana has some role in that space also. Okay. We're also using a couple of our patients who have had cyclical vomiting disorder, and we've published some data on that. In this whole realm of trying to identify different disease states, we created a website called CBDdatabank.com. And the idea of the data bank was to create a database of patients who wanted to self-report. Their diagnosis, it would be, confidential. They wouldn't have to release their name or anything. Just self-report their diagnosis, their treatment that they got in, and their benefits. Maybe they didn't get a benefit. We'd like to know that also, so that we can collate that data. Once we have hundreds and hundreds of patients, we can collate the data and maybe reach out back to them to include them into our prospective studies to see how they're doing, because we want to sort of compartmentalize patients into various disease states, and ultimately be able to enhance the scientific knowledge out there for the medical community.
Okay.
Right now, the medical community has a generalized sense of skepticism, which is unnecessary, in my opinion. But I think they just need to be educated, and they need to be educated a little bit more on what is actually the beneficial effects, so that once they realize that there's beneficial effects, and they see the data, hard data out there, they'll sort of get more comfortable with prescribing it.
Okay. Is the data bank still open for members?
CBD, yeah, CBDdatabank.com. Patients can go right on top of there and register themselves. They can put in all their information, and they can also put in all their information. They can put in their um, diagnosis, their medications they're taking, and the dosage of medical marijuana that they're on, and their effects that they've had.
Okay. What kind of ailments do you see your patients benefit most from taking CBD and medical marijuana?
I've seen that the beneficial effects have been in the diagnosis of epilepsy,
Okay.
nerve pain, such as neuropathic pain, fibromyalgia, and to some effect, joint pain also.
Is that from just like smoking, vaping, taking oils, or just the creams? Is there?
No, so it's a little bit of everything,
Okay.
but more so towards the oils.
Okay.
More so towards the oils.
And I just I had a couple of questions. Like I wanted to learn more about you. So I know you mentioned you have patents. And how many? Do you mind sharing? Like how many patents you have? Or
Yeah, we've been lucky enough to get 7 patents now for marijuana-based medications.
okay.
These are both medications that are based purely on just medical marijuana and medical marijuana with conventional combination therapies. That's in spaces such as epilepsy, neuropathic pain or nerve pain, Parkinson's disease, and we've filed those patents. We also have numerous patents that are in the pipeline, about 15 of them in the pipeline, both as for nutraceutical supplements to help patients improve their quality of health with regards to various disease states and diagnosis states. That's one group of patents that we've filed, and others are prescription medication patents that we've developed and are filing. Hopefully, over the next year or two, we should have another 10 to 15 approved. That would be perfect. Then we can commercialize some of these for the public to use.
Oh, okay, awesome. So I know you're in New York. What hospitals are you affiliated with?
I'm with the New York Cornell and Mount Sinai system.
Okay.
I'm also at Brooklyn Hospital and New York Cornell Methodist Hospital and the New York Presbyterian Community Hospital, where I'm the chief of neurology there. And I've been on staff at these hospitals for 25 years or so, and I've been admitting patients there, taking care of patients there, of all disease states, from strokes to brain tumors to seizures to all kinds of diseases.
And the final question I have was, what's the best part about being a doctor that you've enjoyed?
Seeing a positive outcome in a patient.
Mm-hmm.
That's the best thing, because when you have a patient come to you and you're able to help them improve their quality of life, that really helps a lot. Because you find that they come to you with real anguish. Patients come to you with real anguish, concern, anxiety. They're worried about their own situation, and you can sort of help them understand that this is a treatable condition. Try to get them improved and to see a positive outcome. Many times we can't find a cure, which is true.
Right.
In medicine, we're not miracle workers, but we can definitely help. The idea is to help improve the quality of their lives, and if we can help that, and I find that that's the most gratifying part of being a physician, trying to improve patients' quality of lives.
Thank you so much for taking the time to talk with us. Is there anything you want to tell everybody before you leave?
Don't be scared about trying to talk to your doctors about medical marijuana. Be proactive about your healthcare. Please make sure that you take some research material, print it out online, take some research material, take it to your doctors about your disease state and the use of medical marijuana in that disease state, and educate your doctors about it. Many doctors don't know. They're happy to learn. You just explain to them. They'll be happy to read the material, and they may ultimately come and try to help you get the medical marijuana that you need in your state, so that at least it'll make your life better as a patient. The idea is to improve yourself.
Yeah, that's good advice. Thank you so much. Really.
Thank you, guys.
And have a happy holidays, and just enjoy the rest of your week.
Same to you guys. Thank you very much.
Thank you so much.
Bye-bye.